I have been treating patients with Lyme disease for nearly 20 years. I am board certified in Oriental medicine, but I'm not an infectious disease specialist, but I have taken the ILADS training. I've also seen more Lyme patients than a Connecticut prostitute, so take all this with a grain of salt, but I know what I'm talking about. Science has confirmed 2 ways you can get Lyme disease and a possible third. Number 1. Even though this looks like a fat duck, this is a tick. It bites you. It's on you for 24 hours. You get a fever and flu-like symptoms without respiratory involvement, and a bullseye rash. It's a rash that looks like a bullseye or a stick booby. That can give you Lyme disease. Number 2, your mother has Lyme disease and she was pregnant with you while she had Lyme disease. You can get Lyme disease that way. Number 3, a woman is in a relationship with a man who has Lyme disease. Maybe she's in a relationship with 2 dudes and they both have Lyme disease. Somehow she has Lyme disease. How do you think she got it? Science has not confirmed that this can happen. It also has not confirmed that it can't happen. In my clinical practice, I have seen this scenario. Well, usually it's just one, but you know, Portland, multiple times. Enough that I think it can happen. I'm willing to be wrong on this. It's my hypothesis for now. Chronic Lyme is a whole other weird world of misdiagnosis. I'm going to break it down for you. ELISA test? Pretty worthless. A lot of alternative and functional medicine providers will run PCR tests, DNA something tests, weird tests that have alternative criteria for positive Lyme disease. They are designed to tell you you do have Lyme disease even if you don't, so that you buy a very expensive treatment plan and waste a lot of time and money while you're still sick. Many other syndromes can mimic the symptoms of Lyme disease, things like mold exposure, long COVID, many presentations of fibromyalgia, mast cell activation syndrome, POTS, IBS, Ehlers-Danlos, some autoimmune diseases. Lyme disease is very much within the damp cluster. So if you don't get a confirmed diagnosis of Lyme disease, there are still many other possible reasons that you feel the way you feel, but it's not Lyme. The IgG Western blot is probably the best test that there is. If you have 5 or more bands that are positive on an IgG Western blot, that is a confirmational diagnosis of Lyme disease. Many people in my practice have a history of being bit by a tick, having all the acute Lyme disease symptoms, and not getting treated with antibiotics. Those people later get an IgG Western blot that's inconclusive or negative. Do they still have Lyme? Probably. There is nuance to interpreting this test. Here's some of it. The CD57 test is a measure of a very specific type of white blood cell. It's part of your immune system. I've seen it happen enough times where there's a confirmed history of acute Lyme without treatment. There is an inconclusive or negative Western blot. There is a low CD57. We treat the patient as though they have Lyme disease, and then later they get a CD57 measured again that's within a normal range, and they get a new IgG Western blot, and all of a sudden they're producing antibodies.